My name is Dr. Alexander Berry, a physician who works in Western Massachusetts. This is a brief edited summary of a presentation made on March 22nd at Harvard MIT. The full slide deck is available through a link listed below. The aim is to learn what worked in Wuhan and what didn't work. The main message is that social distancing and home confinement was not enough to control the outbreak at the community level. What did work was a combination of home confinement, widespread screening, and central quarantine. This will be explained in the following slides. What didn't work? Social distancing and home quarantine was helpful and made a difference, but was not enough. This virus spread through families. Infected close contacts, and infected the community. This is a visualization of the key idea. Each index case is represented by a red triangle, and further infections are blue dots. On the left, you can see that home confinement and social distancing was not enough. Home confinement spread the disease through families, and in cities with high numbers of occupants per housing unit, like Holyoke, this will lead to continued spread. On the right, you can see what occurs if we add in central quarantine for all positive cases, even those with only a temperature and mild symptoms. The chain of infection is broken. The red triangles are removed and placed in central quarantine, and there are fewer blue dots. How did this look? A central quarantine strategy was key. There are layers of quarantine using different physical assets. Looking on the left, they built 2 new hospitals and 16 field hospitals, converting conference centers and stadiums. Then they used designated hotels and university dorms in which to place presumptive cases, cases with fever, and close contacts. Here's a picture of a converted stadium. As you can see, this was a large area set up for moderate containment. This is a picture of a university dorm. This again was set up for close contacts and those with fever who were awaiting test results. Why did this help? This allowed progression monitoring. If a patient progressed in a field hospital, they were transferred to an ICU. This relieved the burden of health care system overload and ensured that there was enough capacity to handle cases. What was the other message they found? 60% of the cases were never found. They were asymptomatic community members who could infect others. That meant that increased test capacity for early diagnosis was critical. You will hear this again and again and again from the Harvard and Johns Hopkins experts. As long as we remain in home confinement, this will have to continue until rigorous screening and testing capabilities are deployed. How did this look in the graphic? Well, first of all, the suspected cases, those with symptoms, taken for testing, placed in central quarantine. What happened next was extraordinary. Community workers checked every single household, door to door, for subjects with symptoms. Those subjects were removed, taken for testing, and quarantined. If they had a positive result, they were placed into central quarantine. Again, this is how we see that confirmed cases are placed into central quarantine. Therefore, strategies to contain and treat can happen in converted stadiums or conference centers. Hotels and university dorms can be used for presumptive cases awaiting results. Why is Boston so enamored with college dorms? College dorms cannot be repurposed as hospitals or quarantine centers. They have a role for isolation of suspected cases awaiting results. This is not a good long-term strategy for a central quarantine facility.